Hey there everybody, this is Dr. Matt Joosse at Joosse Family Orthodontics in Williamsburg, Virginia. Wanted to show off this case because I think it illustrates something that's really, really important. And I was talking to a parent recently who had one child go through treatment with braces and another child go through treatment with Invisalign. And I was asking him about, the differences between one versus the other, what he thought were the advantages, which would he choose again if he were choosing for his kids. And he made a comment that he said, well, there's got to be stuff that, there's a lot of stuff that you would have to do with braces that just like Invisalign wouldn't be able to handle. Like my daughter's Invisalign case wasn't that hard. I imagine if it was harder, you'd have to do it with braces. And I said, well, you'd be surprised. Generally speaking, teeth move faster and easier in kids' mouths. There's certain things that we can do to harness the growth of children that also makes certain things possible in adolescents' mouths that doesn't happen with adult mouths. But we can do amazing things in adult mouths as well. And so I want to show you Richard here because Richard came in looking for a nicer smile and a healthier bite. And I want to show you what's possible. And we did this with Invisalign clear aligners. So that was Richard at the start. He wasn't really too excited about smiling because there were some definite crooked teeth. This tooth was flared out, and because it was flared out, it had been super worn down, so it's also kind of misshapen because of how worn down it's been. If you look at how much these upper front teeth overlap these lower front teeth, we call this a deep bite. And when folks have deep bites, front teeth tend to get really worn down. So we have uneven wear actually of the upper front teeth. The lower front teeth are all worn down. And so we're definitely looking for a healthier bite atmosphere here for Richard. Here's a picture of the lower teeth, and you can see just how crowded things are in the front of the mouth. So very, very crowded, especially in this lower right area, but also very crowded in the lower left. We like to treat crowding because when there are crowded lower front teeth, it is very difficult to clean between those teeth. So it's difficult to brush and floss those areas. You can oftentimes see cavities developing right where these teeth are butted up one against one another. And these are also places where gum disease can take off. Here are the upper front teeth, and again, you can appreciate how crowded those front teeth are. All of these side teeth are very tucked in, so it's a very kind of narrow smile appearance as well. And here's where we finished. So we bonded a little wire behind those front teeth to help stabilize them. Bonded the same wire behind the lower front teeth to help stabilize them into their new positions. Got a nice result. Now, I get picky about not these front two teeth, but the next ones being at slightly different levels. And remember, I told you this one is kind of worn down. So if it were full contour, if it were its regular shape, it would probably look a lot like this one, but it's not. And, as a perfectionist, I get really picky and sometimes don't like some of those things. But then I have to remind myself that the magnitude of change here was incredible. Notice how much more of these lower front teeth you can see, so a lot less overlap of the front teeth, which is a much healthier bite atmosphere. His teeth should be protected from being worn down in the future because of that. And here's Richard smiling, and this is the best part, really giving him the confidence to smile. And thinking back to that conversation with that parent that I had, and thinking, hey, who's a candidate for orthodontic treatment? I believe that most people are candidates for orthodontic treatment, and everybody deserves the smile that they want. And so this is another example of that, to be able to do that in an adult patient and make a tremendous change here. Here's some kind of before and afters, and again, you can appreciate just how much was done on those lower front teeth. Incredible changes, much healthier atmosphere for brushing and for flossing, much reduced chance of gum disease and cavities because of this. Same thing on the top. You can see just how much change has happened with those upper front teeth. And again, the confidence to smile. And so this is incredible change in an adult patient. Richard, you were an amazing patient. We accomplished this treatment in about 2 years and in about 6 or 7 in-office visits. So pretty great. That was using our JFO on-the-go remote monitoring technology. And when we have a great partner in treatment like Richard was, we get amazing results like this. And of course, we love to celebrate him, and I love this smile. What a great smile you have there, Richard. Make sure to go show it off, and make sure that you let everybody know that you like that smile. So thanks so much for listening.